Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Olivia Lemon. Today's topic is prehab before joint replacement surgery. How can a prehab program help with joint replacement?
There are many things you can do that will help your outcome and speed your recovery. One of the things is to begin an exercise program before the operation. Some people call this pre-habilitation instead of rehabilitation because you're exercising before the operation in addition to after the operation. And by doing that, you improve the strength of the muscles.
How does a patient know what prehab program is best?
Your surgeon will help you choose the appropriate exercises that will give you the maximum benefit while minimizing the pain that's created while you're doing these exercises. In addition, you want to optimize your overall medical health. If you have diabetes, we want to make sure your glucose is under control. If you have had heart problems and perhaps stents or bypass surgery, you need a check from your cardiologist to make sure your heart is up to this operation.
When should a prehab program start?
As soon as you decide that you're going to have your knee replaced is an appropriate time to begin the exercises.